So in this video I am going to talk about the pelvis fracture. According to Tiles classification, in type A, the fracture is stable. Why it is stable? Because this rim, this is the pelvic rim, it is intact. The fracture is at the anterior superior iliac spine or on the iliac wing. They can be told as an isolated fracture, but they are not coming into the way of the rim of the pelvis, and so it is a stable fracture. While talking about the type B, it is at the pubic symphysis or the sacroiliac joint, and hence it is vertically stable. It is vertically stable, but rotationally it is, or horizontally it is unstable. There are, for the two types, that is B1, B2, it can be 3 or 2, whatever, but type 1 of B is open book type and type 2 is bucket handle. Now in bucket handle type there is contralateral wing involved and ipsilateral ramus involved. So it can be like this combination, and this combination can be told as bucket handle B2 of Tiles classification. So the site of lesion was pubic symphysis. Now on the type C classification, here there is fracture of the pubic symphysis and unilateral rupture of the sacroiliac joint along with associated ruptures of soft tissue and the ligaments like sacroiliac ligament, sacrotuberous ligament, and hence this will be an isolation of one hip bone. It is very dangerous type, and up to 1.5 to 2 liters of blood loss is seen here, and it is a highly unstable fracture. Talking about the signs and symptoms, this all are same, while the pain basically is at the hip, and there is hypovolemic shock and complications of the fracture, that is ARDS. The mechanism of injury here, it is high velocity injury mostly seen in the road traffic accidents. Associated complications can be bladder injury, urethral injury, or retroperitoneal hemorrhage. For diagnosis of the pelvis fracture, we can either take an X-ray or a CT scan. And for the management purposes, if it is a type A classification of Tiles, we have to give skin traction and bed rest because the fracture was on the wing and at the anterior superior spine and not on the rim. Now on type B, in type B, if the displacement is either less than 2.5 cm or more than 2.5 cm, if it is less than 2.5 cm, just give skin traction and bed rest, same as above. But if it is more than 2.5 cm, then you do an open reduction and internal fixation, including plating. It is type C, give an pelvic external fixator. So that was all about the pelvic fracture.